It's something that we've been expecting and hoping for a long time.
QCGN President Eva Ludwig says she's pleased to see money for anglophones in Tuesday's provincial budget. Finance Minister Éric Girard, who is also the minister responsible for relations with English-speaking Quebecers, has earmarked $10 million over 5 years to improve access to health and social services for anglophones. That includes expanding mental health services for a population experiencing higher levels of psychological distress and anxiety than the general population. Accessing legal information is also included.
It's difficult really to communicate when you are either in an emergency situation, a crisis situation, or where you're not well.
And there are studies to back it, according to Lorraine O'Donnell with the Quebec English-speaking Communities Research Network.
I would call this very stark evidence that, in fact, the English-speaking population has higher rates of mental health concerns, illness, and suicide risk.
The question is why. O'Donnell points to the lower socioeconomic status of anglophones as one factor that can affect well-being. Psychologist Dr. Perry Adler says not being able to access mental health services quickly or in a person's first language can worsen symptoms. Social and cultural isolation can also be a factor.
We're kind of the poor second cousins in being able to participate not only in getting information, but having cultural events, cultural activities that are in line with our own cultural longings and needs.
He'd like the government to allow anglophones in the regions to connect with therapists in Montreal over video calls.
They shouldn't be impeded from trying to get those services from outside that sector, and the money should follow them.
Ludwig says the funding isn't substantial, but it is a first step.
The English-speaking community is not an enemy of the French language. We do learn it, but when we need it in our language, we expect to be served.
But she says ultimately laws in Quebec will need to be changed. Angela McKenzie, CTV News.